Dilapan-S, the economics of at-home cervical ripening. Outpatient pre-induction cervical ripening with Dilapan-S is an opportunity for reduced overall hospital costs of delivery, higher patient satisfaction, and better hospital resource management in your facility. When low-risk pregnant women undergoing induction of labor ripen at home with Dilapan-S, they may spend less time in the labor and delivery unit, have fewer cesarean sections, and reduce their exposure to infections. Based on data from clinical trials and meta-analyses, one cost-consequence analysis predicts that if 50.9% of low-risk elective induction patients selected outpatient cervical ripening with Dilapan-S, after its insertion in hospital, the mean cost savings averaged over the entire cohort of women, both inpatient and outpatient, would be $689 per delivery, broken down as $199 for standard delivery, $304 for induction of labor, and $186 for treating adverse events. When averaged over women who switched from inpatient to outpatient, the model predicts a mean cost savings of $1,663, broken down as $480 for standard delivery, $735 for induction of labor, and $448 for treating adverse events. With 1.48 hours saved in the labor and delivery unit and 0.91 hours in the postpartum recovery unit, the model estimates a total hospital stay reduced by 2.39 hours when averaged over the entire cohort. When averaged over the outpatient cohort specifically, the model predicts 3.57 fewer hours in the labor and delivery unit and 2.16 hours in the postpartum recovery unit, for a total hospital stay reduced by 5.73 hours in comparison to inpatient standard of care ripening. Limiting time spent in healthcare settings may reduce exposure to SARS-CoV-2 and other infections. The same model shows a decreased cesarean section rate of 3.78 percentage points, down to 19.5% from 23.3% among all women using Dilapan-S, and a reduction of 6.6 percentage points among primiparous women, from 24.9% to 18.3%. Reducing rates of cesarean section lowers risk of surgical site infections and potential readmittance. ACOG clinical guidelines observe that vaginal delivery is associated with a lower risk of overall severe morbidity and mortality than cesarean section. In clinical studies, women who used Dilapan-S reported high patient satisfaction. They were better able to perform their daily activities, spent more time relaxing, and reported better sleep than those using the Foley balloon. Patients using Dilapan-S should be instructed to report any excessive bleeding, pain, or temperature elevation, and to avoid bathing, douching, and intercourse. Patients should return to the healthcare provider for removal of Dilapan-S at the indicated time and should be instructed not to attempt self-removal under any circumstances. When low-risk women can ripen at home, time and resources are freed for you and your staff to provide care for other patients. And while the majority of women undergoing elective induction of labor will require pre-induction cervical ripening, rates of elective induction may rise. Studies show that nulliparous women induced at 39 weeks have a lower risk of C-section, hypertension during pregnancy, and neonatal respiratory morbidity in comparison to expectant management. To learn more, including instructions for use, visit Dilapan-S.com or click the button below. Let us show you the opportunity for cost savings with Dilapan-S in your facility.